Hopefully I'm in the frame. Hey, what's up, you guys? I had gotten my official diagnosis, I think a few days ago. To be honest, I'm not really keeping up with dates. It's not on purpose, but it's just like a lot going on continuously. So let me start off with my CT scan. We went to my CT scan, and you just go into this place. It's like this radiology museum thing. I don't know why they call it that. I have a whole bunch of different scans there. So you come over, and so it's like this big donut looking thing. And I know like some of y'all probably seen CT scans before, but I've never have. So this was completely new to me. And I'm used to having my husband with me. So it took a lot for me to go in there by myself. So it's like this big donut, and it has like this thing going through it, like a popsicle stick, and you lay on it, and it's pretty much a bed. So because I'm pregnant, they had to shield my belly, and so they couldn't see from my belly down, my lymph nodes and different things like that. They could only see from right at the bottom of my lungs up. Um, and so I lay down on the bed, and they start to give me an IV, and the woman's talking to me, and she tells me how the nurse had just had twins, and they was like, okay, well, is this your first pregnancy? And a lot of people ask me that. Is this my first pregnancy, my first baby? And I say, no, my daughter passed away. This is usually how I answer. No, my daughter passed away last year. And they're like, oh, I'm sorry. And in my mind, it's not like necessarily, it's like, it sucked. But at the same time, she paved the way, to be honest. We wouldn't have known what was going on with the rest of the babies if she wouldn't have sacrificed her life for these babies and stuff like that. And so, that's something that we're going to tell our children. And also, it's like, I tell people, first of all, because she is my daughter, I'm not ashamed of her, but mainly too because of the fact that they might have lost a child, or they might have been through something. I've had conversations with people that's like, oh, well, so and so, I know somebody that's going through it, or stuff like that. So back to what I was saying, they start to do an IV, and they're talking to me. The lady's really nice. They're talking to me, and so they try to give me an IV right here, and that's usually where my vein works. But they was trying to put it not necessarily in the vein. They was trying to open up like a valve in the vein. I've never heard of that, but they like put a little bit of saline in it in order to put the valve in the vein. And so I'm sorry when I said saline. I've been watching a whole bunch of like cancer. Like I said, I've been watching Radiant Raquel. That's and people would call it Rachel, but I think I said it in the next vlog. But Radiant Raquel, about her dealing with Hodgkin's lymphoma. She talks about how the port, they're gonna put saline in it, and it's kind of just got scary and stuff for a second. Let me go back to what I was saying. So they tried to put it in my arm, but it didn't work. So they put it right here. Now, right here and in your hand is like the worst place to get IVs. Holy crap. They are so uncomfortable. They are so very uncomfortable. And so they put it right there, and it hurt. I'm not gonna lie. Usually, like going in my arm, it doesn't hurt to me. And to be honest, I'm the type of person, if something's being done in my body, I watch it, because I don't like the, oh snap, I like to see, okay, well, this is when I'm about to feel the pain. So they put it in, and I think they put the saline in, and the saline, it was like maybe a little tingle or something like that. My neck is starting to hurt. The woman's like, yeah, we're gonna put the dye in you, and what's gonna happen is it's gonna warm your body from head to toe, and it's gonna feel like you're peeing on yourself, but I promise you're not peeing on yourself. And it was funny because as soon as it went in, it kind of burnt a little bit, but as soon as it went in, I felt like I was peeing on myself. And it's like that warm feeling that you get when you're peeing on yourself. And then the bottom of my foot, like right here, it was warm. And then it was like up here. And she said you get a weird taste in your mouth. I really didn't necessarily get the taste. But what happened was I could feel like fluid kind of going past it, and it was weird because it made me want to swallow. So I got my hands up again after the stuff go in. They stay in the room with you until the stuff go into your system, and I go through the donut thing again, and it tells me inhale, exhale, and they do that I think twice, but the machine starts to gear up, and it does sound like a jet machine. So it's like like that. And so you end up going in the machine, and like I said, I had to close my eyes to make sure that I didn't have a panic attack or anxiety attack or anything like that. So the next day at 2 o'clock, I had a doctor's appointment, and that's what you're going to see in the vlog after this. And so I come into the doctor's appointment, and You know, me and my husband was talking about doing this natural. And we kind of based it off of the fact that we felt like we might have had some time in order to do stuff and, you know, get my body working and stuff like that. So we wanted to do it natural. But, and this is my video pretty much telling y'all what I'm going to do as far as treatment and stuff like that, which is crazy. Like, I have to say treatment. Like, I'm literally going to be doing treatment. I'm literally going to be doing treatment. It's carrot juice. That's crazy. Carrot juice tastes like milk to me. That's crazy. But, so we go in there, and then the doctor comes in, and he's like, so we got your scans, and he shows me my scans, and it's not like the x-ray that you usually get from like front. What it is since I went through the tube, it's like from here down, and it shows it going through my body like this. So he goes down and he shows me the lymph nodes under my arm. The one on this side is like this big up under my armpit, and then I have like smaller ones that's near it, and I got them in here too. And I don't know if y'all can see it. I don't know if you can see it, but I got one popped up right there and one that popped up right here, but this one right here is getting bigger. And I feel for new ones just in case. You never know. And so he shows me the scan going from here down. And I'm like, okay, you know, that's something I can work with. Then he gets to my lungs. And so he goes down, and then it's like your windpipe and stuff in your throat and your spine. You know, it's showing you kind of like a sandwich. My front, back, windpipes, stuff like that. And then he shows me my lungs. My lungs are black, which are good, meaning like there's nothing there in my lungs. But then he shows me these two big black circles, which is about the size of the one that's up on my arm, about this big, probably bigger than that, that's on both sides of my windpipe. So I got my windpipe, and then it's like the big circle right here, and like lumps. So me and my husband, when we saw it, we was like, oh, fuck. You ever just get that feeling like, fuck? So we saw it, and he was like, so I'm pretty sure, because he felt me before, and he was like, yeah, we think you're stage 2. I'm like, okay, you know, I could beat stage 2. Stage 2 ain't that bad. We get there, he's like, no, you're stage 3. Stage 3, not 6, but stage 3. Like, I'm fucking stage 3. And so he tells me that I have the 2 enlarged lymph nodes that's on both sides of my windpipe, which in turn will get bigger to the point where it will cut my oxygen off, pretty much. He tells me I'm stage 3, and I'm like, fuck. You know, I'm pregnant. I'm 14 weeks pregnant now. During the appointment, I was 14 weeks pregnant, but I'm 14 weeks pregnant, and so I have been doing research on whether or not chemotherapy is okay while you're pregnant. People say it's okay because of the placenta. The placenta don't let the drugs come through it, and I'm like, ooh, placenta, you're the mother before I'm the mother, so you do your damn thing. But it's just worry. It's just worry. And so I'm hoping that the baby can get here safely and things like that. And so, like I said, he said I'm stage 3, and then he's like, yeah, so we're gonna go ahead and you can go check out. And it's like, he doesn't have any, it's just, he doesn't have any sympathy. I don't know how to explain it, but when a doctor is cool, if it makes a doctor isn't just like, oh yeah, well, this is what we're gonna do by the books. Is more of where it's like, are you okay? You know, we're gonna make sure your baby's okay. We can't promise anything, but we're gonna work hard to make sure your baby, you know, it's none of that. It's none of that. It's like, oh, I said, so how's this gonna, okay, but hold on. He told me that I would be doing ABVD, I think it's ABVD, chemotherapy, and I've researched it, and I've seen people dealing with it and stuff like that. And so I kind of knew what he was saying when he said it, ABVD. I already kind of knew the stuff, and I've done my research before going to the doctor's appointment, because before I felt like he was just telling me all this stuff and he wasn't really trying to explain nothing to me. And that's the reason why I'm switching doctors when I get a chance, meaning as far as I'm going to that. So he was like, go ahead and check out, and we'll schedule you to get your port. Now, this is the thing, that my husband was asking me what's wrong, and I'm just standing there, and I'm just like, oh, like, really, like, my mortality is being questioned. Like, I'm 26 and it's just like, hey, it's some bullshit. Pretty much. Lost my daughter last year, getting a cancer diagnosis, pregnant, happy as hell to be pregnant, but now I'm worried about the baby. And so when it comes down to it, like I said, I'm going to switch doctors because I need sympathy at this moment. Not sympathy like, oh, well, you know, I feel bad for you. No, I don't need you to feel bad for me. I need sympathy in the sense that you understand why this baby is so important to me, why these things are so important to me. Or you don't even have to understand, but you can at least be like, mm-hmm, mm-hmm, mm-hmm. You know saying? Like, you can at least somewhat show some emotion towards me. Like, I understand that you've dealt with a lot of patience, but dang, you know saying? Like, dang, like, you know saying? And I just feel like me and my husband was talking about it. We just feel like he just don't care about the baby's life. And I understand, like, my life is important, but I want you to care just as much about my baby as I do too. So I've been calling people, and I have an appointment Monday, and then I also have an appointment Friday. I have an appointment Monday for a hematologist because I'm looking for somebody that's going to care about my baby. And then I'm also looking for, I also got an appointment for another oncologist on Friday. And then from there, then I officially decide, because of the fact that I'm pretty much trying to pick a doctor. OBGYN is cool because I haven't went to my first appointment with him yet, but I went with him when I had the cyst on my ovaries, and he was pretty much like, it worked before, it's going to work again, it's going to be okay. And I was just like, yeah, I like you. And my actual doctor's office that I had came from, the one that I was going to try to give like a natural birth at, they actually been calling me and keeping up to date with me, and that makes me feel really good as far as like somebody caring. And it makes me cry when I talk to somebody that actually cares, because of the fact that, you know, like, the two people that I have right now is my dad and my husband, and it's hard to know that it's hard to know that the certain people just don't have your back, and they're not going to have your back regardless, and they didn't have your back through that, and they're not going to have your back through this and stuff like that. And so, you know, that's kind of hard, but at the same time, it's just something that you have to deal with in life, and I've learned to do that, and I've kind of learned how to disconnect my emotions from certain people, to where you just use them for what you can use them for. And it's not like in a sense where it's like I'm just out here using people. It's more of where if I gotta ask, I'm just gonna ask, and I'm not gonna care whether or not you say no. You feel some type of way, you go talk shit about me, I don't care. But that's my diagnosis. I am stage 3 Hodgkin's lymphoma, and that's what they know now. When they do the MRI, that might change, and so if it does change, I'll give you an update. I'm currently looking for somebody that's going to care about the baby as well as me, and tomorrow I'll probably end up going to the emergency room because I have this growing pain, and I want to make sure everything's okay with the baby. Of course, like, they're 14 weeks, so I don't feel them move yet, but sometimes I do feel like they move, but then I poop, and I'll be like, okay, that was just gas. But I thank y'all for watching and keeping this journey with me. After watching Radiant Raquel, she inspired me to be positive through this. Like, I need positivity. So I'm trying my best to be extremely positive to this, and know that I'm going to make it through the other side of this with my baby. I'm going to get through my treatment. I think he said I might do 12 or 6 of them. I don't know, and that's just from him. With another doctor, it might be different. But I'm going to beat cancer, have a yelling, screaming baby, a happy husband, a happy doggy in our house. So I thank y'all for watching, and I'll see you guys in my next video.